Oh look, a doctor who can tell me something about coronavirus. Let's have a look.
The coronavirus hysteria is fake. Don't worry, this isn't going to be one of those mad conspiracy theories.
Oh yes it is. This is going to be a conspiracy theory, innit?
So here are some facts. I know that's pretty daft to be putting out on the internet, but these are real facts and you can check them.
Yeah, don't you worry, Dr. Coleman, we'll be checking the facts.
Number one, the World Health Organization says that the average number of deaths from flu, that's the ordinary old-fashioned flu, are between 250,000 and 650,000 a year. That's global. The US Centre for Disease Control and Prevention says that in an average sort of year, 45 million people will get the flu. The old-fashioned, nasty, keep you off work, maybe keep you in bed, and if you're very unlucky, maybe kill you flu. The total number of deaths since the coronavirus was discovered and found itself a public relations manager has been about 6,500. That's today, the 16th of March. It will undoubtedly be more by the time you watch this. The number who would have died from flu, ordinary common or garden flu, in a bad winter period would be at least 10 times that. 10 times the number of people who have died from the coronavirus so far altogether.
So far, so good. The World Health Organization does indeed say that somewhere between 250,000 and 650,000 people die every year from influenza. But had Dr. Coleman do any more research into influenza, even from the same source, the World Health Organization, he would have discovered that influenza is already global and endemic. That isn't yet the case with COVID-19. This is only the beginning of this coronavirus. It isn't global, it isn't endemic, but it is getting there and it's spreading fast. But let's look more locally at where COVID-19 is having an effect. Let's take Italy for example. Italy gets seasonal outbreaks of flu viruses. The Pope gets sick from the flu. But this doesn't cause the collapse of the healthcare system. The news from the Italian doctors who are fighting against COVID-19 on the front lines of the Italian health service paint a very different picture.
We are probably 9 to 10 days behind Lombardy, and the intensity that this epidemic reached in the area around Milan was really hit very hard the healthcare system. So many hospitals are nearly collapsing, and the forecast for the next 10 to 15 days is even worse. So this situation changed completely our lives in little more than 1 week. We are working very hard with extraordinary efforts in order to increase our ICU capacity and hospital capacity, with also high dependency units working a lot in order to increase availability for patients. But we are not sure that will be enough. So my suggestion is that you get prepared as soon as you can, because once you start admitting severe ICU patients, it's probably too late for social distancing, isolation and lockdowns.
Now, considering that COVID-19 is a new virus and that it is not yet global or endemic, but is having a catastrophic effect on lives and on the healthcare systems, where it is having an effect in countries like Iran and France and Spain and Italy and of course China, let's take a quick look at how this virus is performing in the 4 months that we've known it. Hopefully this short graphic gives you a better idea of what is actually going on, compared to the flu virus, which is all over the world. It's global and endemic, with a kill rate of 0.1 to 0.5%. This new coronavirus, with a kill rate of somewhere between 2% and 5%, is far more infectious than the flu. Globally, the projections for how many people it will reach and how many people it will kill are absolutely staggering, and without proper intervention, without state measures, this is truly frightening.
Worldwide, the coronavirus death toll now tops 3,000, with nearly 90,000 cases. But even those numbers are nothing compared to what could happen in the months ahead. Today, CBS News' Jim Axelrod spoke with one of this country's top experts from Harvard on viruses, who has a startling prediction.
The number that I think is grabbing a lot of people is this estimate: 40 to 70% of the world's adult population could be infected.
Yes.
Accurate?
That is, it's a projection, so we will find out if it's accurate as things go on. It is a best estimate that I've been able to make based on a combination of the mathematical models that we use to track and predict epidemics.
So in terms of addressing the numbers that may get people panicked, what can you tell us?
Well, again, the 40 to 70% is a number a proportion of the population, adult population infected. And we know that some people who get this infection have no or almost no symptoms whatsoever. What we don't know is how many there are like that. So if, say, that's half the people, then the 1% or 2% that we're seeing in the symptomatic people is cut down by half. Whatever the number is, it's going to take a toll. If it really does spread as widely as that projection says, and that's what I think is likely to happen, then there are going to be millions of people dying, and I don't think there's any way to get around that. And so I think there's real reason for people to be concerned. I also think that we can turn that concern into actions that will make the situation better.
So according to this Harvard infectious disease epidemiologist Mark Lipsitch, there are going to be millions of people dying. Maybe we should put some numbers to this. The world's population is 7.7 billion people. 40% of the world's population is 3.08 billion. 70% of the world's population is 5.39 billion. From what we know, coronavirus has a kill rate of between 2 and 5% of all those it infects. So if this infects just 40% of the world's population, that will result in the death of between 61.6 and 154 million people around the world. If it reaches 70% of the adult population of the world, that will mean the death of somewhere between 107.8 and 269.5 million people. COVID-19 is not the flu. So of course, after his selective use of information and his rather dodgy use of the numbers, Dr Vernon Coleman has a conspiracy theory. In fact, he has two. Listen.
Now, I have a suspicion that this is just the beginning. I think that what's happening here is the demonization, the marginalization, the dehumanization of the elderly, because the elderly have become a global problem in economic terms. All those pensions are destroying the economic viability of a lot of countries. And in order to try and get rid of some of those old people, governments everywhere are doing some very strange and wicked things. In the United Kingdom, for example, elderly patients who have macular degeneration are very often not treated because there isn't any money. There's plenty of money around for cosmetic surgery or gender reassignment, but there's no money around for stopping old people going blind. The United Nations has decreed that if someone over 70 dies, then they don't really matter because they don't count. And so nations everywhere are very happily welcoming this because it gives them a chance to kill off the elderly without it looking bad for the nation's health services. Younger people may welcome this, but they might also like to think of two things. One, if you're 30 today, you'll be in the danger zone in not too many years' time. And secondly, if 70 is now the cut-off time, and doctors are going to say, we're not going to treat anyone over 70 because they're not worth treating and we haven't got the resources, when will it become 60? And when will it become 50? Those are things that we all need to be very careful about. There's another thing as well. I don't think it's as important as the marginalisation of the elderly, but I rather suspect that when the vaccine becomes available to protect us all against the coronavirus, it won't be voluntary, it'll be compulsory. And when that vaccination has become compulsory, so will all other vaccinations, because that's what governments everywhere have been pushing for a long time. So those are the two hidden agendas. I think we're heading for compulsory vaccination, and I think we're heading for the marginalisation of the elderly.
So for Dr Vernon Coleman, this is all a massive global conspiracy against old people involving hundreds of thousands of doctors and nurses, medical professionals and politicians all around the world just to top off the elderly. Absolute hokum. As for the other conspiracy that this is all a great big ruse to get anti-vaxxers to vaccinate their children, come on, enough. COVID-19 is real. Conspiracy theories will not help. They will make it worse. Stop spreading false information. There are things we can do, however. We can work to flatten the curve.
An epidemic curve is a chart used to display the occurrence and speed of new disease cases. It shows the number of cases over time, so during an outbreak, you see peaks in the curve. A particularly steep curve is created by a large number of cases in a short period of time. This is happening in Italy right now, and it's utterly overwhelming their healthcare system.
To flatten the curve, to stop our healthcare systems from being overloaded during this crisis, there are things we can do. Wash your hands regularly in warm, soapy water. Use hand sanitizer when out and about. Cover your mouth with a tissue or with the sleeve of your arms, not with your hands. Don't touch your face. Clean and disinfect those parts of your house that get touched regularly. Light switches, taps, door handles and tabletops. Stop shaking hands. Keep distant from other people, about 2 meters or 6 feet. And for goodness sake, stop spreading false information. You'll save lives.